Thank you. Well, I think I can go ahead and get us started. Hi, everyone. Thanks for joining our Bevel Up and Resource Collection walkthrough webinar. I'm Alika Upadhyay, and I'm a Senior Associate on the Drug User Health team. Also joined by Lily Armstrong, who is on our team, and Juan Tirado. We're also joined by Heather Edney, Jonathan Levia, and Coleman Cox, who will introduce themselves when we get to their section. And for this webinar, we will be providing a quick NASTAD and National Harm Reduction TA Center intro, as well as a quick Bevel Up intro. And then we'll go into an overview of the resources. After, Jonathan and Coleman will talk about Bevel Up in action at their organizations, St. John Community Health and Cherokee Nation Behavioral Health. And Heather will provide tips and tricks for utilizing the Bevel Up materials. And then we'll have some time set aside for questions and answer for the panelists. And just for some housekeeping, we ask that you remain on mute throughout this webinar until the Q&A portion, and feel free to send any questions into the chat box or the Q&A box. We'll be keeping an eye on both of them and pulling out any questions that are asked. Closed captioning should be on. You should be able to toggle it if on the bottom right of the Zoom desktop browser. And this webinar is being recorded. We will send out the link and the slides within a week. And then just for a quick overview of NASTAD, NASTAD is a nonprofit membership-based organization that represents public health officials who administer HIV and hepatitis programs funded by state and federal governments. We provide proactive and reactive TA to health departments and community-based organizations around the US. And in doing so, our vision is to have a world free of HIV and viral hepatitis. Specifically on the Drug User Health team at NASTAD, we support the CDC-funded National Harm Reduction TA Center, where we provide proactive and reactive TA to harm reduction organizations and health departments throughout the US. On this slide, there are some examples of TA that we can provide in the assistance available section, as well as ways to request TA. Easiest way right now is just emailing the Drug User Health TA at nastad.org. But this safer use educational resource and library, which is now Bevel Up, was created through the National Harm Reduction TA Center. And then in creating Bevel Up, we had a list of goals that we wanted to achieve. One, there's a lot of existing educational materials, but it can be hard to know where that information came from and whether it's still representative of how and what people are using. For example, some go-to educational materials don't mention fentanyl or other synthetic opioids. Also, there has been a sharp increase in the number of harm reduction programs, SSPs, and other partners distributing safer use supplies and information in the past several years. It takes time for programs to learn what messaging is most effective and what questions people have in their area. However, programs need to start somewhere and give people something to respond to. And lastly, it takes a lot of time and a lot of energy to make and edit educational materials. It's often challenging when it's like a PDF of a scan of a flyer. So SSPs are constantly learning from participants and trying to figure out how to better serve areas and groups with their materials. So these Bevel Up materials are customizable and easy to edit. So hopefully you can see all of these goals throughout the materials. And now this is what Bevel Up has grown into. I'm going to pass it on to Heather just to give a overview of Bevel Up and introduce themselves.
Hey, everybody. Thanks for joining us. So Bevel Up started as we were going to do a print resource, make it customizable, and then it morphed into an online resource as well. And I think that Alika actually gave a really great overview of why we did it the way we did it. And we covered all bases, I think, as far as if you want to send the set of cards to a printer, there's bleed lines. It's like print ready. Your printer would love you. If you want to print it out in-house, you could print it out in black and white. You can print it out with your logo or without your logo. Jonathan's going to show us later how you do that. And if you want to just like scroll with somebody, if you're like talking to somebody who's at a site and you're wanting to show them information, you can just scroll through the site and, read and scroll. The Bevel Up card series is very basic in that we know there's like kind of 5 or 6 bullet points per side. It's really all that fits on a card, and people, it seems, like that's kind of like the sweet spot of what people remember. But because it obviously is not comprehensive, we've created an element called the drill down. And then from the drill down, there's like another drill down. So it's like, how far down the rabbit hole do you want to go? There's like layers of information that get into all of the details surrounding safer use, safer injection, and then alternate ways of using. Let's see. Yeah, this is, we did this started during COVID. So that was like QR codes were a thing, and DIY was the thing, like the whole like sourdough bread baking or whatever. So like the whole DIY part of it seemed like a great idea. I think it still is. And because a lot of programs do not have the money to send stuff to the printer. So also, if like you cannot stand the graphics or the colors, or the text because the text is outdated, you can customize all of that in Canva. And we've tried to make it like as simple as possible, but because there's so many moving parts, it's not exactly that simple, which is why NASDAQ has their phone number and their contact information on like every page in case you need help. And I think that's it for now. Did I forget anything? We're gonna just keep going and say that I did. Is that it? Okay. So I'm gonna introduce Jonathan now, and Jonathan is going to show you the cards in action.
All right. Well, hi, everybody. Let me just share my screen really, really quick. Hopefully you guys see my background, right? All right. Let's go ahead. Off. So my name is Jonathan Leva. I'm actually representing St. John's Community Health. We started our harm reduction program last year, and we're actually working really closely with Heather Edney, and we recently started incorporating our Bevel Up materials in our program. So who we are. So St. John's, we're located in South Central, East LA, and Central LA, right? So South Central and East LA, we have more than 20 clinics all throughout Los Angeles, and we have about 3 mobile units as well. And we also started our street medicine team, which also goes out at least once a week that I also spearhead. So Bevel Up really comes in handy when we're trying to communicate safer practices to our participants. So as Heather mentioned, if we go to bevelup.com, we are hit with their welcome page, why it was created. And for most of you who might be asking, give the authority or is there somebody backing them up? They actually were backed up by the CDC. So if you're worried about the accrediting of it all or the credit of it all, they were backed up by CDC. So everything was highly researched and vetted, and this is the most palatable way to give the information out. So where to acquire this information? So the easiest place to go is to the element section and go down to the cards, right? So from the cards, they give another quick overview of how to access it, where to acquire, but you can honestly just go down here and you have access to everything from vein care, safer injections, smoking glass, chasing with foil, booty bumping, naloxone overdose. So let's say, for example, you guys wanted to do vein care, right? So if you click download, it will redirect you to their Dropbox, where, as you can see, it contains all the information that you want to access already, right? So for this example, we're going to use booty bumping. So you'll go into booty bumping, you'll see they have different versions, right? PDF, PNG, another PNG. But then you also have a little box right here, a folder that says customizable. So you'll go ahead and click this, and you're able to download based on whatever your person needs, right? So for um, uh, my designer, he prefers PDFs, so I would download the PDF version. Some people prefer like the PNG because it's an actual picture. So let's say that we did PDF, you would just click download and it should go into your download folder, which for us it's going to be right here. So from there, I would go into my Canva, and this is canva.com, the most easiest way to update your flyers or create a new flyer, right? So for me, I would hit create a design, right? So I would hit that, and I usually just say doc, right? First click, first one, it creates a blank document that you're able to modify to your liking, right? So on the left-hand side, you're gonna notice upload. So you're gonna hit upload, and from there, you're gonna hit upload image. It should be part of your download folder. So if you have any type of templates, like we have our Bevel Up template that we downloaded, or any pictures you want to add to it, I would say this is the time to add them, right? So for us, I went ahead and downloaded the booty bumping one. I also uploaded our QR code that's actually attached to my website, along with our logo and different things that I wanted to add to any type of flyer. So we'll go ahead and grab this, move it over, and you'll see that you could go ahead and modify it to your liking, right? So for me, I would go ahead and stretch it out. Um, they already, like Bevel Up was pretty cool by leaving a little spot here for you guys to automatically add in your logo, right? So for me, I'll go ahead and add it here. Oops. There we go. Uh-oh. Uh-oh. What happened? Right here. All right, so it's there. And then you would go ahead. Don't take over. There you go. Okay. So if you wanted to, you could go ahead and make that smaller, and then you should be able to. Oh, well, if it was working for me. Sorry, it's for some reason it's not giving me the option right now. But typically, you're able to just get it from here and move it over to there. But for time's sake purposes and not me going around and clicking all these things, that would be like the gist of it all. You would be able to upload your information on there and easily move it over, um, and add in your personal information for your organization. What we have done for St. John's actually, where we actually blew them up. Um, and we actually have them in little frames, right? Where we have them displayed whenever we're doing outreach. When I say booty bumping is like the number one thing that like catches people's eyes, and it becomes like such an like a opener to start talking about different forms of consumption and just having that dialogue, it makes it fun, right? And it creates that dialogue that we all want. And it's just like, what is that? Like, let's talk about it, right? Um, so it could be as easy as that, just having it out there, up there, presented for everybody, reading it. Another thing that we did, at least for St. John's, we have like a specific SharePoint website. So I created one that's for our staff or volunteers, anybody within our department or our organization can come into our internal website. And I included Bevel Up to be a resource whenever a provider wants to talk, say for consumption, with the patient and they want content to download. So they could easily just come here, click it, and print it out if needed whenever they need. And that's basically the gist.
Thank you. Thank you. Oh, Jonathan, do you want to tell them the one other thing?
Oh yes, the big thing. Because Bevel Up and Heather and everybody have been so cool with St. John's, I am taking the initiative to get a lot of the cards translated to Spanish. So as soon as we get those translated, I will send it back to Bevel Up and hopefully get that sent out to all of you guys, so we could have that in English and in Spanish.
Yay, thank you. Coleman, I think that you're up next.
Awesome. Hello, everybody. My name is Coleman Cox. I'm with Cherokee Nation's Harm Reduction Program. I'm the program manager. I've been with Cherokee Nation since 2010. I got started in the prevention industry and worked a number of SAMHSA grants and moved up to the harm reduction supervisor last year. Helped to launch this program. It's been a roller coaster and going 100 miles an hour. We've done a whole lot of great things so far in our first year of opening. We opened our doors in September of last year, September 20th. We received the SAMHSA harm reduction grant, and our first year goal was to serve 75 unique people. As of yesterday, we reached that 500, which is our full goal for the whole project by the end of 2025. So we've been rocking and rolling. We've been providing your basic needle exchange, first aid, wound care supplies. We also provide sexual health resources, male and female hygiene kits. We are also doing HIV and Hep C screening and providing linkages to recovery and treatment. So far in that year, we've had 10 linkages to treatment, which we really want to celebrate because we know as harm reductionists, the goal of harm reduction isn't really to coerce people or to try to trick them or get them into treatment. It's all about readiness. And that was never our goal, but just because we try to provide an environment, like I'm sure many of you are on the call do, of an environment that is inclusive, that is full of love, respect, and unconditional positive regard. People, they crave that and they want to move on to a different part of their life and to a recovery pathway. And I've had many long conversations with Heather and Lily about the subtle nuances of trying to educate people about harm reduction. I'm a person in recovery myself for over a decade, and it is sometimes we forget what the life is like when we've been so far removed. And so it's very helpful to programs like us that are just getting started to understand what some of these best practices are now. Things may have changed, since we were back in the game many years ago. So it's been very beneficial to have Heather just providing boss level TTA, sharing Bevel Up with the world, sharing it with us. It's really helped shape our program to make it as successful as it is today. A little bit about how we use Bevel Up. So like when we got started, we didn't really have a lot to work with. We begged, borrowed, and stealed content from here and there, and it kind of looked like a Frankenstein, as I'm sure many of you all have experienced. When we got introduced to Heather, Bevel Up was still under was in the workshop, being fine-tuned and stuff, and so just many long hours of getting to understand and pick her amazing brain We use the concepts that Bevel Up teaches, that the National Harm Reduction Coalition teaches, that many other great resource teaches, to create our own set of educational material. And so we had that launched, and that we got approval from our tribal health system to do that. And it, in the meantime, we were still wondering whether, Bevel Up was going to be CDC approved, and we needed something because our doors were open. We needed to be able to educate people and send something home with them. And so I used a lot of the information, made my own stuff. But now, since CDC has reviewed Bevel Up and given their stamp of approval, we can now display that too. And that was very important because we're the largest tribal health system in America. And we have a state-of-the-art system, and there's communications requirements that are involved with that. And so having that stamp of approval is super important. At this time, I think I want to take you guys on a little journey. Let's show you what we're working with here in Cherokee Nation. This is an amazing facility that the chief of the Cherokee Nation, Chuck Hoskins Jr., was able to provide for us through the Health and Wellness Fund Act. Turn my camera around. Hope everybody's seeing nice and clear. So we've got our Bevel Up information on the wall there inside our care corner. This is where we provide male and female hygiene kits. And we got Chris Rich here, who's one of our outreach workers, building some harm reduction kits here. Oh, yeah. Chris, why don't you say hi to the nice folks on the camera here?
Hello, everybody. My name is Chris. I've been at this harm reduction clinic for about 6 months. And my biggest problem with this place is it wasn't here when I needed it 3 years ago. And it is such an honor to be a part of something that my tribe is building. And to get to work with Heather, who is a phenomenal human being. He's just always available for us. And the material she has is so good. It's just been great. And I'm also going to throw in, this is my 3-year sober birthday. So,
Happy birthday to you, man. Happy birthday. So these are harm reduction kits that we're handing out. We got a fit pack, personal disposal. We got our wound care, xylazine, fentanyl test strips, sterile water, Narcan, safe sex kits, lockable bag. People go out the door with one of these. We also, this is what I was telling you just a little bit ago. We have our cards that you can print and download, just like Jonathan showed. They're customizable. We put a little tagline here: proud partner of the Cherokee Nation Harm Reduction Program on them. So you can make them your own if you want. We have our other material that we use to provide more in-depth education on injection best practices. And these are based on practice-based evidence. We have our syringe size guide here that's like a little shadow box. People can tell us what they're used to using, and we can help educate them on what might be a better choice for them to reduce harm. And then we have our other material here that we're using. Now, all this is developed through the guidance and TTA that came from Heather and Bevel Up and NASDAD. And we are very thrilled to be open and serving over 500 people last year. So I'll go ahead and turn this back over to the next speaker, and you guys can take it away. Thank you for having me today.
Thank you, Coleman. Thank you. Let's see. Alika, should I talk about the process, or are we jumping into questions, or?
No, Heather, if you can chat about the process for a little.
Okay. Okay. So the process. Okay, here's the deal. It is amazing that this was vetted by the CDC and that it was, signed off by the CDC, because there's programs that can't give out information unless there's some kind of seal of approval. But what's crazy is that the content was created by people who use drugs, thinking about what we would want providers to know, or what we would want other people who use drugs to know. And we got a lot of feedback from people all over the country. Because, you know, this thing went through many revisions because there's like geographic, there's, you know, God, like there's a gazillion things that every line in there was like very thought out. And it's still not going to work for some communities, hence the ability to customize it, you know, like it's just, but it's like it's a starting point, I think, more than anything. In the olden days, I wrote Getting Off Right with Sin Stern and Rod Surge, oh my gosh. And then I created those zines, Junk Food, also from way back then, and a bunch of other educational material. And there is a lot of new information, like, you know, certainly with fentanyl, there's new information. And also, gosh, I don't know how to explain it, but yeah, I guess just having it vetted by like people in the medical community and people who use drugs from all over the place, it just feels like the right thing to be putting out there, with the caveat that it's a work in progress and will need to be updated. And if you notice anything on there that's driving you crazy, that you're like, you think that's wrong or whatever, like, we would love to know, because we want to be getting accurate information out. Two of the people that I worked with on this, who I would run the content by, I called them the Fentanyl Collective on the website. They died. They've since starting Bevel Up have both died. So they would have been really excited to be, you know, to see the webinar today, because I drove them insane with a zillion questions while I was working on this with the team. And so I don't know. I don't know where to go with that. Sorry. What was I just gonna say? Oh, Lily and Alika were crucial in this process. And so I want to also major shout out to them. This was like, it definitely took a village, like many villages. And the artists that worked with us, and Joanna Benson Martinez, who helped write the content, like all of these people, I think contributed to making something that hopefully will be used for a long time to come. I think that's it.
Thank you, Heather, Jonathan, Coleman. Yeah, I mean, I think that we can move into any questions that folks may have. We can spend some time answering anything.
What do you know? We created the perfect website. None of us came in knowing how to build, or I certainly didn't. I mean, it's been such a dream to work on this with Heather and Alika and everybody else who's been involved. There are so many expert brains coming together to create these. And I'm just so grateful and continuing to create them. Jonathan, we're so excited. to have your materials and to be able to share them with everybody, and definitely an open door. We're having a little bit of a chat in the chat box about xylazine. If anyone feels compelled to use Bevel Up materials or templates or safe for use information in combination with xylazine information or in the creation of a xylazine web resource, we would love to be able to share that back out with people. So definitely it's an open door to see how folks are using this. I understand that it's been a resource for people who are participating in mail-based SSP and who don't necessarily have opportunities for off-the-cuff conversations with outreach workers, and who really might have the time to sit and dig down and drill down into all of the layers of information that's there. So again, open door to hear about how people are using it, hear how it could be more helpful. It's something that we also want to hold on to and keep track of and reinvest in. So we have a little bit of an internal list of topics we'd like to cover and other things that we'd like to do with it, for sure. And I see that there's a hand up, so I'm going to stop talking.
Hey, yeah, this is Gabby from Prevention Point Pittsburgh. We run an SSP out here, and I was the person in the chat because I guess I'm interested in knowing how you all are taking in information, like knowing that analogs are coming out, xylazine. I mean, the last 8 months here has been wild. And just kind of figuring out what's the best way to like share information or be in communication about changes or resources that might be helpful for our community and other communities. Thanks for your work.
One of the pages in the top menu bar is resources. And so that page is quite amazing because it's like the source content for the content used in the card series, but it's also like, you know, next to distros, like informational flyers are like amazing. You know, there's all kinds of different resources on there. But in response to your question about like how to like keep it like updated, like I mean, when we ended this project, or like ended, it seems like it hasn't ended, but like when we like sent them to the printer, xylazine like wasn't a thing. So yeah, I would turn it over to Lily to see like what we could do, you know, whether that's like just adding content, having it be like a wiki page or something, and adding people. I don't know. Okay, never mind that. But like something where a new content could be added, it'd be amazing. I'm gonna claw back the wiki thing because that sounds hard.
Yeah, that's a whole new web design skill set to build out first. But definitely, Gabby, that's a great flag. Thank you for us to revisit that resources page, because there has been some really good information coming out recently. And yeah, seconding Heather that we are like learning how to use this now that it exists in the world, and figuring out what the feedback mechanisms are. There's definitely, like as she said, there's a lot of links to our website and to our email. If you ever feel compelled to say like, hey, sorry, there's a truck going by. Hey, like we've been using this like one pager flyer a ton at the exchange and people are like really engaging with it. Like I want to put that on the resources page. Like definitely again, open door in that regard as well. And I got my start at Prevention Point Pittsburgh, so I'm so glad that you are here.
Nice. Yeah, thank you so much. I appreciate it.
Well, I am loving this. It's so good to see you. I'm sorry, I've been off camera. I have to run to the airport here in a second, but it is I just want to say before I jump off and into some of the conversation and content here, this has been such a sweet project, just such a project that is based in community and inspired by community and designed by community. And I think a theme that has been coming up for me, and hi everyone, I'm Laura, I work at NASDAQ. Lead up our drug user health team. Anyway, one of the themes that I think I hope everyone takes away from this project and many projects is that, you know, the National Harm Reduction TA Center, NASDAQ, HRC, you know, all of us are increasingly direct lines to helping inform the CDC and state and federal partners about emerging trends and about emerging needs. So thinking through additional content and things that folks are feeling and hearing from participants on the ground, experiencing in your communities, that stuff, I mean, we're finally at a place where, you know, our federal partners are willing and interested, wanting to put resources behind building out and being really responsive in this way. So we all have a real open door. Like, we want to be hearing what's going on with you all so that we can help be that kind of go-between and communicate that to other you know, higher up folks or folks in your jurisdictions to really help make sure that we have resources available to have these just really incredibly important, impactful projects like this. And it's, I just gotta say, so cool to see in action throughout this project. So I just want to appreciate Heather and Jonathan, I mean, everyone who has contributed to this. And yeah, it's just really great to see it all come to fruition. So I am appreciative and appreciating you.
Thank you. We'll see you. I'll say one thing that I learned, which is that so as somebody who like used drugs for a long time, who's still totally in the mix, I forgot my like one of my golden rules, which is like I had worked with some graphics people who did not use drugs. And so like I can't emphasize, and they're amazing and we love everything and they're like, cannot say enough, but like, just like the point of the bevel facing up versus facing down, like these things are very hard for just people who don't use drugs to draw, you know, or like to understand. So that is like a major just reminder to me, and I love to just share that too about, you know, there's a lot of talk about involving people with lived experience in a meaningful way, but like literally that's what has to happen at every single level with everything. And I know that, and yet I seem to have forgotten that for a minute. And it, you know, like, yeah, whatever. Hopefully you know what I'm talking about. So onward and upward. It can only, yeah, get better.
Another thing that I would encourage all of you, especially the up and coming SSPs or harm reductionists, if you guys can collaborate with each other, you know, share your contact information, see where you guys are going, and like as you guys are noticing, information is life, right? Sometimes you guys may know things at work that we may not, and having that open network between us will save a lot of people, right? So if you have information that is crucial that everybody needs to be a part of, you know, reach out to Lily, myself, or Heather, or your fellow harm reductionists and spread that information or resource that you may or may not. So that's my little point. That's why I'm stepping up and trying my best to get this information translated in Spanish and hopefully get it translated to multiple languages so we can reach our demographic the correct way. So, yeah.
Thank you.
I feel like we were like organically doing parting thoughts. Coleman, do you have anything? Okay, if you don't. Maybe he steps. But if there are no other questions or anything, I think that we could close out. Yeah, well, thank you all so much for being here today and listening to us chat about Bevel Up. It's been a really long project, but I'm really like happy with how it's turned out. And we will make sure to send out the slides and the recording and a link to the resources. And as you're working through this project, putting it in your SSPs, if you have any questions or feedback, always can reach out to Nastad or Heather. We can include emails in the final email.
Thank you.
I'm smiling because of Jonathan mentioning the booty bumping being a great conversation starter, and Heather having also shared a little bit of a learning experience with Coleman about having some of these materials sent to a printer and not being prepared for the extent to which the printer was going to be reviewing the materials that they were printing. So it can be a conversation starter in lots of ways, but I think that also ties into Heather's comment about, you know, putting people with lived experience front and center, and like find those print shops that are maybe like a little bit more well versed in the work that you're doing, or a little bit more comfortable with the types of things that you're providing, just to maybe save yourself some headaches.
Thank you. That's a really good point. Yeah, it happened with more than one printer. They printed all of the posters except booty bumping, and they just held up the job for the longest. And I finally had to comment, I'm like, are you not printing this, like this other poster? And you know, they made an excuse. So that was like on one end of the continuum. The other end of the continuum was like, they were like, we will not print these. We can't, like, we can't. So if you have trouble finding a place to print, I don't know if we can like say that here, but we can provide that information. They're really cheap and fast, and they have been they now know that they're going to print all the cards. So they've been vetted.
That was my final thought.
Alrighty, well, guess we can close out. Bye, all. I hope you have a lovely rest of your Tuesday and week and everything. And thank you all for joining.
Thank you.